Hello folks, one more video. Today we are going to talk about the types of drusen. Drusen are focal deposits of extracellular debris, usually located between the basal lamina of the RPE retinal pigment epithelium and the inner collagenous layer of the Brooks membrane. Drusen can be found in normal-aged human eyes and in eyes with age-related macular degeneration. The largest single component of drusen is esterified lipid. In addition, drusen composition may be of carbohydrates, zinc, proteins, apolipoproteins, and components of the complement system. There are a few types of drusen based on histology and current multimodal image methods. Let's start talking about hard drusen. They are defined as discrete yellow-white deposits sited under the RPE. They are small, of less than 63 micrometers, and have sharply defined edges. Hard drusen are common and considered a normal consequence of age, although AMD may begin with hard drusen. They are often associated with loss of overlying retinal pigment epithelium cells. For small, flat hard drusen, fundus photography may be more sensitive than optical coherence tomography. For hard drusen, fluorescein angiography FA demonstrates typically window defects. Hard drusen itself, they are not a risk factor for wet age-related macular degeneration. Second type of drusen, soft drusen. They are yellow-white elevations typically between 63 to 1000 micrometers in diameter. Soft drusen contain significant pools of esterified cholesterol. They are typically found in the posterior pole of the fundus and in the superior and temporal quadrants of the macula. Soft drusen are seen as mound-shaped, moderately hyperreflective elevations of the RPE on OCT of various sizes. During FA, soft drusen are minimally hyperfluorescent in later stages due to pooling. During autofluorescence imaging of the edges, some soft drusen appear as hyperautofluorescence. There may be an association between soft drusen and advanced and wet AMD. Third type of drusen is cuticular drusen. They are numerous, uniformly round and punctate deposits found in a densely packed arrangement. They are typically 50 to 75 micrometers in diameter. The definition of cuticular drusen implies a large number of adjacent drusen to achieve the starry sky appearance. Cuticular drusen have a homogeneous internal content that's typically hyperreflective on OCT. In cross-section, cuticular drusen have a blunted triangular shape, and they appear as a saw-tooth pattern on OCT. During FA, cuticular drusen produce multiple pinpoint sites of hyperfluorescence due to drusen apices, whereas the same locations are hypoautofluorescent on FA. They occur often in middle-aged individuals and are usually asymptomatic. Cuticular drusen may be associated with AMD, but also dense deposit disease and causative variants in the gene CFH. The fourth type of drusen is subretinal drusenoid deposits. They are focal deposits accumulated between the outer retina and RPE, which is different than the other three types of drusen. Subretinal drusenoid deposits may be termed also as reticular pseudodrusen. They are internal to the RPE, consequently light striking and not filtered by the RPE. They show a range in size similar to that of soft drusen and appear slightly blue or white. The fluorescent angiography findings of subretinal drusenoid deposits are subtle, ranging from no change to minimal hypofluorescence. By OCT or histology, subretinal drusenoid deposits vary in shape and thickness above the RPE, appearing as conical or flattened and as hyperreflected lesion on OCT. Subretinal drusenoid deposits can be large enough to disturb or shorten the overlying photoreceptors. Subretinal drusenoid deposits are associated with a reticular pattern of decreased autofluorescence. Usually patients with subretinal drusenoid deposits have a thin choroid. Eyes with subretinal drusenoid deposits have significant risk of development of both neovascularization and geographic atrophy. Of note, two variations of drusen are calcified drusen, which lay below the RPE, are heterogeneous and have a thin choroid. The second variation type, packed drusen, also are positioned under the RPE, and they have often secondary neovascularization and a thick choroid. I hope you like this little summary of types of drusen. See you on the next video.